of them. Can I invite our four social entrepreneurs from the INSEAD Social Entrepreneurship Program? Carmina from the Philippines, who's running INSEAD. Sara from Pakistan, who's running Sehat Kahani. Priya from India, who's running HealthSetGo. And Larissa from Indonesia, who's a very senior manager at HARA. And one thing I should note is that this is not designed as a women's panel. They are invited here because they really are four of the strongest people in INSEAD social entrepreneurship programs. So thank you for making the time. It's fine, we don't need it.
I just need your help.
Just get more of this. I'll take the corner one. So thank you. I mean, let me ask, start, we had this conversation the other day with a two-part question. Just briefly introduce yourselves, telling what you do, and give the personal side of the story, because if I recall, each of you has a story on how you came into this and what you were doing before that, and why do you do what you do, while, of course, describing your work.
Me first? Yeah, go for it. Okay, hello. Is it working? Okay. So, good evening, everyone. I'm Carmina from INSEAD. I'm the CEO of INSEAD. And we're currently the Philippines' leading provider of student loans for unbanked college students. So a little bit about how I started, right? Okay, so very quickly, a little bit about my parents. My mom specifically, since this is a woman, let me dwell on my mom. So my mom actually grew up with 9 siblings. Both of my grandparents were farmers, very related to, they were in poverty, and in the Philippines, we don't have student loans. So the only way my mom could get an education was through scholarships. And she did that, and I'm lucky to be here because of her. But my mom was actually the one who exposed me to lending. My parents set up a small village bank. But my perception of loans when I was growing up was very negative. I asked my mom, why do you lend to strangers who, very naive, why do you lend to strangers who cannot pay, obviously cannot pay their loans? But my mom always taught me that loans gave people the opportunity to succeed in life, and that repayment was more about character than capacity to pay. And so that stuck with me as I grew up. But starting INSEAD was more about my experience in college. And that would marry with what my parents taught me about lending. So in college, a lot of my peers dropped out because they worked sometimes 5 or 6 jobs, and they just couldn't sustain the cost of education. And a turning point was a close friend of mine. I took up industrial engineering. He actually took his life because of financial difficulties. And so in the Philippines, a college degree is it's a do or die. If you don't have it, you're gonna be in a dead end career. Even you need the paper, or you can't get a good job. So a lot of low income students, since they were born, their family tells them your only hope, you have to graduate. If you can't, we're gonna stay here forever. So that was frustration about this broken system in the Philippines of not having sustainable education financing program was what made me start INSEAD. So very quickly, I don't know if that was too long, but our vision at INSEAD is to create a lasting student loan program for the developing world. So what we had observed was that student loans were working at scale in first world countries, but in developing countries, due to volatile employment markets, weak capital systems, student loans weren't working. So we do this through 2 innovations we developed. First, is a credit scoring tool that predicts if a student will repay or not. So we have a 99% repayment rate so far, compared to our government, which is 2%. So they actually discontinued their student loan program. And second is to tackle the employment problem. We developed a rapid job placement tool delivered through digital coaching. So right now, one in-house coach at Invested can serve up to 1,000 borrowers, and our average job placement rate is 24 days. So we virtually eliminated the employment problem with that. So yeah, that's Invested.
So one of the things that I noticed, and please correct me if I'm wrong, is that unlike Prodigy Finance, which I think many people are familiar with, you're working actually with college kids and not just people that are getting into premium universities, but you're trying to make it much more inclusive than Prodigy is able to.
Who here is familiar with Prodigy Finance? I love them. In fact, they were. I researched them before doing anything like for Invested, and there were a couple of firms like Prodigy already working in 2016 when we started. And I personally felt I didn't want to be redundant in the market. And I felt that there were so many players already working on master's degrees, student loans for master's degrees, but there were very few working for undergraduate. But that also is because it's way more risky, right? So that's the problem our team chose to tackle, is more of undergraduate, simply because it was a gap that we saw. So we also do loans to master's degrees in the Philippines if they come to us and ask, but it's a model that was easy to develop, but for undergraduate, that's where we mostly focus our tool on.
Thank you, Carmina. Priyanka?
Hi, so this is on, right?
Yeah,
okay.
That's
okay, so my name is Priya Prakash, and I belong to Delhi in India. And I started an organization called HealthSetGo. It's been around 3 years officially, and probably 3.5 to 4 years just as from an idea to where we are now. And the reason I started HealthSetGo was from a very personal space. Because when I was a child in India, as a lot of you must have eaten Indian food or have been from India, Indian families basically convey their love for their kids through food. And and in India, the definition of a healthy child is actually somebody who is well fed. I mean, you say, oh, your child is looking so healthy. It's actually a way to, to say that they're really chubby and overweight or whatever that is. And that's, and that's how I was when I was a kid. And I guess at a certain point in your life, that's fine. When you're young, people come and sort of pull your cheeks for it. But I think when you get older and you sort of, start looking in the mirror and you start to have a sense of self, and there are people around you who, really make you feel bad about the way you look. And when you look in the mirror and you don't like yourself, I think that's what started at a very young age for me. I had a lot of unforgiving classmates, a lot of them who used to make fun of me. They used to bully me. A lot of people used to call me ugly, fat, all kinds of things. And, for being someone who had performed so well in her studies, up until that point when I was in grade 6 or 7, I think after that it sort of just dipped from there. I lost a lot of self-confidence. I basically didn't even have the guts to, raise my hand in class anymore. And I think that was a very low phase that I went through, where for me, my emotion was expressed through the food that I was eating. And when I went to college, it sort of became even worse, because at that point, a lot of girls just wanted to be thin. And then I basically went on the other side and I stopped eating. And it was just this whole emotional roller coaster in my life. I think up until the point that I found actually the sport of weightlifting, when it's now been almost 7 years, and since I found fitness and I found weightlifting, I incorporated health back into my life. And if I am sort of sitting here today the way I am, I think it's because good health has got me here. And what now I realize that my life's mission is to make sure that every child has access to the kind of knowledge that I have now, which in India it's very hard, because India is one of the unhealthiest countries in the world. We have the highest rates of diabetes, cancer, and heart disease, and these diseases are the biggest killers right now in the world as well. And just to take a preventive approach to it is what I wanted to do. So today, HealthSetGo, which is my organization, we work in schools in India, and our goal is to run school health programs so that eventually, when a child enters the school at the age of 2 and they leave at the age of 17, they have become a healthy adult. You know, they can deal with life in a much healthier way. They are mentally and physically healthy. And today, till now, we have impacted more than 200,000 students in India. And from day one, I wanted it to be a model which was a sustainable and profitable business model. I never wanted to do it in a way that, wasn't valued by people. And so today, schools do pay for our service. We've been working across the socioeconomic strata in India, across all kinds of schools. Parents and schools are paying for the fact that we are able to do an annual medical check of every child at the school. We have an online health platform for every parent where we track their child's medical reports. We have insurance programs. We have school-based health clinics. So this has really shown good health outcomes, and we're continuing to build on this. Just from a financial viability perspective, I still do believe in the power of the social enterprise. I believe it's possible. Hopefully, in the next few months, in the best case scenario, we should cross $1 million in revenue. So we do have our fingers crossed for that. And I think it's been a great journey. So
quick follow-up. Can you say a little bit more about the role of tech in what you do? How do you use technology in your work?
Yeah, so in India, again, when we started with our health program in schools, we realized that a lot of the current medical information of a child when they joined school was all on paper. And after that, every year, every school used to get a height and weight done of every child, and they used to write it sort of in a notebook and a diary at the school, and that's where it used to be. It never meant anything. It never went back home to the parents. Health was never tracked the way a report card of a child was tracked. And so, we came up with a way to completely digitize this process. So right from the time our doctors would go to the school, and we used to have a dental checkup of every child, an eye checkup of every child, so the doctor itself used to enter all the data on an app that we created for these doctors. So the digitization point was the time of the checkup, and that used to in real time get translated into an online medical report that parents could access, along with our algorithms, which basically provided recommendations based on which disease was detected and the nearest doctor around them. And what we noticed that the moment we started showing these data analytics to parents, for the first time, all these conditions that were previously sort of unseen by parents, because parents are really busy working, they don't realize that their children are suffering from various things. They started to realize that. We also gave a school-level dashboard to the school saying, 40% of your kids are obese, 20% of your kids have dental issues, and they started thinking about, what are we serving in the school cafeterias? Can we make a difference? And so technology has really, really been more of an enabler in the situation, and has really sort of helped accelerate our services and make more impact in the process.
Thank you. Priya, really impressive.
Hi, this works.
Yep.
Okay. Hi, everyone. My name is Larissa Sidarto. I'm from Indonesia. I work for HARA. HARA is an agri-tech startup. Maybe a little bit about myself. Previously, I've interned in several places, in World Bank, at a think tank, Center for Strategic and International Studies. I've also dabbled in consulting, Accenture, and then I started working for Citi, and which actually I was the management associate. So a lot of my peers were actually people from INSEAD. I had a lot of fun in Citi. I loved it. But one day I realized, what sort of impact am I giving to the world? Why am I making the richer richer, the rich richer, whereas there's a lot of people unfortunate? And it made me reflect about myself. I've been very fortunate to be very privileged with good education and lot of opportunity for good jobs. But what about all the other people who are not as fortunate? There are a lot of thinking behind it. I thought, I was telling my father about it. Well, maybe I should make my own social enterprise when I'm already 40 or 50, when I'm already well off, and with then. But then he made a good point. He said, why wait? If anything, do it now and learn fast, learn now. If it doesn't work out, worst case scenario, it doesn't work out, you're still marketable. And I was like, that is actually
you can apply
kind of
to
true.
the MBA program at INSEAD, right?
I was like, oh, true. Okay, do that. So I joined HARA. HARA is an agri-tech startup. So a little bit about the Indonesian landscape. There's around 38 million smallholder farmers in Indonesia. And they make up about half the population that makes less than $1 a day. So when we're talking about the bottom of the pyramid, these are the farmers. And then what we found out was not a lot of them have access to finance. And then why, right? Then we figured out, data is not recorded in the agriculture sector. So for formal financial institutions to be able to identify credit-worthy farmers, it's just too expensive. It doesn't make sense. And because of that, the next best thing, what these farmers do is they go to the local money lenders, or what we call loan sharks. And through them, they charge exorbitant rates. And so that's actually where HARA comes in, and our mission is to make the invisible farmers become accessible through data. So how we do this is we empower local community leaders in the villages with an application. So our hypothesis is that farmers don't have smartphones yet, at least not all farmers have smartphones, but someone in that village has a smartphone. And so we share our app, and through our app, these farmers, these agripreneurs, what we call them, our field agents, they approach farmers who are essentially their neighbors in the village and, input data. And one of our biggest hypotheses is there are people who are willing to share data for future potential benefit, and there are stakeholders who are willing to pay to access those data. And so our very first successful use case was that these people, now that we have the data off, are able to apply for microfinancing. And so within the past 1.5 years, we've gathered 29,500 farmers on our ecosystem. And through our bank partners, we have successfully disbursed microfinancing, and with a repayment rate of around 98%. And with the consistent good results, our bank partners are even confident to disburse, to give credit facility for us for around $15 million. And I think the best part of it is proving that these people are actually able to pay, right? These were previously unbankable farmers who are actually a good target market. They're able to pay and they're able to flourish. So with that same data sets, now we also offer crop insurance. So if harvest fails, they have protection. We work with local farm input stores. And so with the loan that they get, they are able to purchase farm input products through the stores. We work with local off-takers. This is still to be tested, but the idea is what we want to do is give options of various access throughout the whole life cycle of the farmer. So before they farm, they need working capital. After the working capital, they need access to products. When they farm, they need protection if there's flood, too much rain, flood, no rain, too dry, pests. And then at the end of the day, market access. So what we try to do is give access and give options for them. If the farmer at the end of the day wants to go through the loan shark because it's their uncle or their family members or they have some sort of personal connection, which happens, we're okay with that. But it should not be their only option. So what we're doing is we're giving options to choose. So that's it about me.
So quick clarification on that, because I think we had this conversation earlier, because in our age of concerns around Cambridge Analytica and Facebook and all of that, you were explaining in our conversation how you ensure still respecting the privacy, and it's their choice, not somebody else's choice, what happens to their data. Can you say a bit on the technology side of that, and how do you ensure that?
Oh, sure. Okay, so we're dealing with very private data, right? Your IDs, imagine their national identity, we have marriage certificate, we have family certificate. If you're married, you have your marriage certificate. If you're divorced, you have your divorce certificate. If your spouse is has passed away. We have the death certificate because these are all dependents. We know exactly where they farm because we geotag. So interesting about that. Indonesia is very diverse. 70,000 island with many people across, right? And we are very diverse with our unit of measurement. It's not just hectares, it's not just meters squared. We have various different languages with different conversion rates. And I've even asked a farmer, where do you farm? Or how big is your farm? From that coconut tree to that coconut tree, which is not translated at all to a loan application. Now I understand. And by simply putting this geotag feature on our app, where the agripreneur walk circling the farmland, we exactly know the polygons of the land, and which converts right away to hectares. Oh, 0.3 hectares, 0.5 hectares. We don't have to try to guess what coconut tree and coconut tree means. And so we're dealing with very sensitive data, what they plant, when they plant, and all these. And so consent is important, right? We also don't want our field agents, our agripreneurs, to be suddenly putting random information or even applying the loan when the farmer doesn't want to. So I said farmers don't have smartphones, but they have future phones. So we implement one-time PIN. So for whatever data input, data changes, application submitted, farmers will have to give their one-time PIN to the agripreneur, who will have to input it on the app as a sign of consent. So that's one. Second is at the back end, we're also working on, we're building through utilizing blockchain technology to make everything traceable and more secured. But as Priya said, technology is something that enables and how to make the engine works behind. But at the end of the day, we need to have a clear business model and a mission, because everything is not all rosy, it's not easy, and a mission of why you want to do it, right?
Very impressive. Thank you, Larissa. Sara, please.
Hi, everyone. My name is Dr. Sara Khurram. I come from Pakistan. It's a very, very beautiful country. So my story is, so anyone here from Pakistan, by the way? No, as expected. So I come from a middle-class family in Pakistan, and my father, he decided when he married my mother that he's going to have 3 children. He also knew that he's going to have 2 sons and 1 daughter. And he also knew that through a typical Pakistani or a South Asian parent, that first of his son will become a banker, second will become an engineer, and the third one is going to be a daughter, and she's going to become a doctor. So unlike you all, I didn't have the privilege and the opportunity to choose my career. So he got a very good ROI on his investment, that my elder brother did become a banker, the second one did become an engineer, and I did become a doctor. So when I entered into medical college, and our medical colleges are very, very traditional. So it's not like these fancy classes. They're like big auditoriums with fans, tall fans, and no ACs. And they're like 300-400 space auditoriums. And this is a top class medical college in Pakistan, where you have to pass a lot of tests and a lot of examinations to be in the top 400. So I walk into the class very excited, and I see that 90% of my class is made up of female doctors. And men are only sitting, as we call them in medical field, inverted commas on the sides. And all the content is in the middle, which are the female doctors. And that made me super happy. But medicine is 5 years in Pakistan. So as we started to go year from year, I started to realize that the girls who were topping in class started gradually to get married and have children, and started leaving college, or started to plan to leave college after they graduate. And that just kind of gave me a revelation, and we all sort of found this phenomena happen all over Pakistan. And this is actually a phenomena in Pakistan. It's called the doctor bride phenomena. So majority of our medical workforce is made up of female doctors, almost 70%, but only 23% go from graduation to official work practice. And many of them falter in the middle due to marriage or responsibilities, or because they only become doctors to get a better hand in marriage. So they become housemakers, and they take care of their children, and they're not allowed by their families or their in-laws to work professionally in a medical workforce. But what it does in a country like Pakistan, which has 207 million people, out of which 60% live in poverty, is that 75% of people in my country are not privileged enough to get access to a qualified doctor in their lifetime. So all of them are showing to nurses or quacks or dispensers or vets, but they don't get access to a qualified doctor because majority of your workforce is sitting at home. The inverted commas are migrating out of the country for better opportunities, which is very fair. And what is rest is an unqualified medical workforce to take care of your healthcare. And and it personally hit me when I became a doctor bride, but more importantly, there was a time in my life where I couldn't work. I moved to a new city with a child, and suddenly I was in a house all alone. And then with an ex-partner, we developed this concept that can a female doctor sitting at home provide consultations to a patient who's far off in a community using technology. And that's what I do now. So my company's name is Sehat Kahani. Sehat means health in Urdu, and Kahani means story. So it's very poetic that we're trying to change the way health stories are written in Pakistan because we want to give them a good ending. So we have a telemedicine platform that connects female doctors to patients who need qualified, affordable, accessible doctor. And we do this through two ways. So for low-income communities where people don't have the privilege to have smartphones or laptops, we actually partner with nurses who have clinics in communities. We upgrade their clinics and we train that nurse that whenever a patient comes to your clinic, you take the history and examination of the patient, put it in an electronic medical record system, which we call EMR, and then take the patient for an online consultation with a doctor that is present in your laptop. And we also provide different services such as labs, ultrasounds, and a small pharmacy in the clinic so that patient can feel that he's in a one-stop primary healthcare shop in that community. And for patients who have access to healthcare, like people like you and me, who belong to the middle or the high income strata, for them we've developed a mobile app. And the only difference from the clinic is here a patient can upload their own medical history and connect to a doctor themselves in real time. And here the doctors are available 24/7. So we have 25 clinics in 25 low-income communities across Pakistan. Pakistan has 4 provinces. We are in 3 provinces. We've seen 125,000 patients till date. We've been able to create a network of 1,500 female doctors, and we've put 70 of them in work in our clinics. And on our application, we have just developed the application this year, and we've gone through a more B2B route. So we give this application to employers to get their employees insured for health coverage through our OPD consultation platform, because OPD care is very, very expensive in Pakistan for a consumer or a corporate employee to afford themselves. We also plan to integrate this application in other third-party apps and launch a retail version. But it's a journey of 3 years, and what's kept me going personally is we've been able to treat thyroid cancer in a 17-year-old just through a doctor looking through a camera in a community that's 1,000 miles away that she's never been to in her life and never go. We've been able to treat infertility in 2 patients and let them have children after 8 years and 10 years of marriage. We've been able to send a child for a cardiac surgery after being diagnosed in our clinic, again through history and examination. So that's what keeps us going. And I'm very proud of myself that I've built a company that has women empowerment in its ethos. So even in my company, we have 70% females in leadership positions, and 80% of my total company is made up of females. I'll share a very interesting story if we have time for 1 minute. You all are studying finance, right? How many are studying finance?
It's not a specialization, everybody does.
Perfect, okay, great. Sorry, I'm not an MBA, as you can all see.
No, some schools do have a...
Yes.
We are just a racket.
So we advertise in our company for a finance manager. And we got 83 CVs. And not one female candidate applied out of those 83 people. Because finance in Pakistan is not a job that a girl does. So then we reposted saying that we specifically, something triggered in me. And I said that, how can this happen? In a country of 200 million people, you don't have a female finance person. So we reposted and we found a finance manager who was going through a very hard period in time. She got married and she had a child and she had to leave her job. And she came back and she's now becoming our CFO after serving 2 years, hopefully, if she stays with us. So there's a lot more to female empowerment that we all see. And that's my story. Thank you.
Thank you very much. I have a clip on. I'm special. I'm the professor, remember? So it's been a real pleasure, and I mean, I feel so fortunate that we get entrepreneurs like this as participants in programs here at INSEAD. So I have 30 of these in my course this week, so you can tell what amazing inspiration it is. So thank you for making time for that.